Welcome, James. So the question I've got for you is: you're a GP. You're doing a home visit in a nursing home. One of the patients, he's bedbound, needs constant care. He can't eat. He can't go to the toilet. Needs help with all of that. He's asking you to refer him to a clinic in Switzerland, so that a doctor there can help him die with dignity. What do you do?
So in this situation, we've obviously got a patient who is wanting to undergo euthanasia.
Mm-hmm.
So I think it's important in this situation that we think about, the different people involved in this. So for example, how does his, it is his autonomy over his decision. So you've got to initially consider that. How is his quality of life? It's mentioned that he has quite a low quality of life. He can't function much on his own anymore. So it's difficult for him to live a happy life. So his mental health and his physical health are being affected. So would they benefit him that way? Possibly. However, you've also got to think about, are you doing, so you could go into the ethics of it. So are you doing harm by potentially, allowing him to go there to end his life? Or are you potentially doing good by sort of, this is what he wants and he believes that he'll benefit from it.
Okay.
So he thinks he would have the autonomy over that. Also, it's important to discuss, what the actual organisational procedure is for euthanasia. Obviously, in the NHS constitution, it's not allowed. It's illegal in England. So that's another important part to consider. Potentially, the family thinks about this. Are they aware that that he wants to end his life? Are they involved in his care? And maybe if they knew this, would they try and support him a little bit more? So it's important that you try and communicate with the family or ask him to. And then I would potentially go into, where do we go from here? So why is he feeling like this? So it could potentially be mental health issues, depression, anxiety that he's feeling while he's living in the care home because he can't do very much. So potentially looking into prescribing antidepressants and looking into the sort of, after he's had this consultation with you, where do we move forward from here? Seeing as, this doctor won't be able to refer you to this clinic. So actually, what can we do within the NHS to sort of help you out a little bit with maybe some different medications and things like that to help him function a little bit better? And potentially discuss with the care home what they can be doing to support his mental health as well. So yeah, those are the things I would go over with this patient before moving forward with sort of referring him to any place.
Yeah.
Can we address the problems at hand initially before sort of discussing these matters? See if we can really try and improve his quality of life before.
Okay. So you actually touched on this, and that's my next question actually, is could you kind of elaborate a bit more on the ethical considerations you were having in this discussion?
Yes. So the ethical consideration. So I think initially autonomy, this patient is described that, what they want is to end their life. They believe they have such a low quality of life that, it's not worth continuing. So it's worth, that is obviously in medicine, you have to respect the patient's wishes. Sure. They have full sort of authority over their own care. However, again, from the doctor's perspective, they can only offer the treatments which they have available. And obviously euthanasia isn't one of them. So, then you would have to think about, are you doing harm by potentially not doing this? They have a particularly low quality of life, low mood. So would you potentially have to look into the different treatments that you could offer? So are you doing harm potentially by letting them go ahead with this euthanasia, or by not doing it as well. So either way of that argument, and are you doing good by potentially letting them do this, or are you not really by referring them, because that is not what they want. You are going against the patient's wishes.
Okay.
And finally, sort of, you could go into the sort of justice. Would it be fair for you to refer this patient? Whereas across the country, this is not sort of allowed. So it's important that you're fair to all people. This rule is constantly enforced, so that all patients get the same treatment. Well, not the same, but sort of equity in their treatment. And that it's important that we follow the NHS guidelines that are in place. So just for equal patient care. So yeah, thank you.
Thank you very much. Thank you. How long was that? Was it timing?